We're highly educated, so all of us have 4 years college education. We're all licensed as registered nurses, and in addition we have a 2-year degree, a master's degree in certified nurse midwifery, so our full title is a certified nurse midwife.
What we do overlaps a lot with the doctors, so we give prenatal care, we attend women while they're giving birth and deliver the babies, although as midwives we call it catching the babies, not delivering the babies, and we take care of women postpartum. We also see women for their annual exams for years to come, which is a really sweet part of our job because we lots of times fall in love with the women we take care of during their pregnancy, and then after they give birth, we don't get to see them anymore. So if women come back and keep getting their annual exams with us, we have a chance to check in with them and their family and see how things are going. So
we get to see them for their next baby.
Right, and their next baby if they can come back for another baby. So what we do overlaps a lot with the doctors. I think we don't do cesarean sections, so if a woman needed that, then we would have the doctors do that, although we can assist with the surgeries. And if women have serious health problems or the babies have serious health problems, then the doctors take care of those women.
We have a holistic approach, but we actually take a look at your pregnancy and your birth in the context of your life. So in your visits, we would want to hear how things are at home, for example, or if you have something on your mind, talking about that, because we understand that that affects your pregnancy and your birth as well. So it's a more holistic approach to healthcare. We really get to know you. We get to know your hopes, your fears, your desires for your birth. We get to know, you, not just you, but your family as well. And we try and incorporate that into our care for you. So we spend more time. We make sure that your questions are answered at your visit. And we spend the time to make sure that not only do we answer your questions, but we answer them in a way that you can understand and that it's satisfactory to the woman.
I think anybody is an ideal candidate for a midwife. Doesn't matter what age you are, as long as you're essentially healthy, and 85 to 90% of births go completely fine with no complications. So anyone can be a candidate. And there is a preconception or a myth about midwives that we are only interested in women having natural, unmedicated birth. And that really is a myth. We just really want women to have the kind of birth that they want to have. And so, as I mentioned earlier, some women really don't want to feel any pain, and they're interested in getting that epidural as soon as their feet hit the labor and delivery floor. And if that's the case, we're happy to support that, and we want to provide women with all of the information they need. What's going to happen? What's your experience going to be like? So there's no surprises when that happens. And we write it on the chart in big letters, epidural, as soon as possible. So we're happy to provide women with that kind of care. You're not out on a limb if you're working with a midwife. We're not going to come to your house in a flowing paisley skirt eating vegetarian food. You can see us in the office eating, we like cheeseburgers and pizza like everybody else, in at the office with the doctors. And you would see us for your prenatal care, but if there was anything that goes outside of normal, things that become less safe or complicated, then the obstetricians are there working hand in hand with us. And you would have the support backup. There's that support, there's the safety net there if things go outside the range of normal.